As an occupational therapist, I work not only in the hospital setting, in the clinic setting. I also work with people in their homes to make sure that homes are safe for people to live in, so that they have enough strength and stamina and endurance to be able to live there safely and appropriately. I also prescribe them adaptive equipment in case they need help with bathing, dressing, those sorts of things, to make it just a little bit easier for them to be able to do what they need to be able to do every day. Adaptive equipment are pieces of equipment that I help people obtain that makes it easier for them to maneuver in their environment. So say a person has a walker that they're using, they might need a walker tray over the top of that to make it a little bit easier to get things from one place to another in their house or in their kitchen. They might need what's called a sock aid or a reacher to help them get dressed in the morning, to pull pants up and get socks on. They might need a handheld shower head in the shower to make it easier for them to be able to reach and wash all their body parts. They might need what's called a tub transfer bench, so that you don't have to be able to step over into the tub, which could cause a fall. Basically what they would do is sit down on the bench and then swing their legs in. Makes it a little bit easier for them to be able to shower on their own safely. So when I go into the home, some of the typical hazards I see are cords laying in and around the home, whether that be from lamps, other electrical devices in the home. Sometimes there's not enough lighting for the patient at home, so really educating them about the different types of lighting and task lighting that will really make it easier for them to be able to do, say, things in the kitchen, or be able to see well enough to brush your teeth or comb your hair in the bathroom. Another big fall hazard is throw rugs. You see those a lot. I see them often when I go to people's homes for home safety assessments, and that's one of the first things I tell my patients is to get rid of them. One of the things that I recommend for older adults to do, this is good for anyone to do, is to stay active, and whether that be through walking programs or exercise or any type of physical activity that you can do throughout the day, integrating that into your daily routine is one of the biggest things to help older adults be able to have enough strength and endurance and be able to do what they need and want to be able to do every day. Even functional tasks like raking the leaves or playing with your grandkids, or even doing simple stretching or exercise or aerobic activity is very important in keeping healthy and keeping well and strong, so you're able to stay in your home for as long as you're able to.